Now, back. That's a standard package. You open like any sterile bag. They will be having always from one side.
Expiration date on it?
What?
No expiration date on it?
Oh, that's a good point. That you should check expiration date. Yes. Here you don't. I don't even see expiration. Hold on. 15 March 15. So it's good point. Yes. You should check on anything and everything. You check expiration date. You open the wrap. Apparently, yeah.
When do you think the thing that we need to clean and wash
It's in there.
No, you first clinic you already done.
The
done.
assessment.
You already
During
assessed the
assessment.
patient.
And
You will be. Oh yes, you don't clean with the washcloth. You will clean with the iodine.
With the iodine.
The first cleaning always comes that way.
So first we come, we introduce ourselves, we would tell the patient what
You
we
do
want to
assessment,
we
you
assess,
position the patient.
and we position the patient.
Position the patient and assume that patient was already clean. So now, how do you do that? Huh? You gonna tell me?
Yeah, the show.
No, you don't have to show me. You
Turn it.
see? You open the sterile package. Right? And again, if you tell me, you got 1 inch here around, if you tell me that you contaminated, I won't fail you. Because I know you know what you did wrong. But if you keep doing and you will persist, I didn't do anything, oh, I don't like that.
Fair.
You know, right. Looking inside. You got gloves. I don't need to have anything. I just drop them here. Below 1 inch. You got the drape. 2 of them, as a matter of fact. Which you wearing regular gloves, the drape you can just take right there and drop right here. You see? You don't need to be sterile yet. Are you getting what I'm telling to you? Are you getting the message?
Yeah.
Look what I do. I'm making your life easier.
You are.
Look.
Yeah.
Now I have a problem, right?
Which one?
Big problem, because now I have to be sterile, right? So I'm taking regular gloves off, I can wash my hands, and now I'm dealing with the issue. Always wash your hand before
And after.
and after. More you
So
wash,
before you change your glove, you have to wash your hands.
that's
know
smart,
that.
but you know, yes, it's a good practice when you change your glove. But when you in the procedure already in the room and you have open sterile, you might not
you
have
might not,
access to
right.
that. You just dump the gloves and you put the another gloves, okay?
Okay.
You open that up. You see? That's on the side. Now, what I have here, iodine. Before I open that, I need to do, before I do anything, you must ask patient for allergies. Many of them, they are allergic to shellfish, and they will be allergic to mango. A question. If the patient is allergic to mango, what they will be allergic to?
Iodine.
Mango? No. Oh.
Mango is
Not
iodine.
mango.
It is iodine.
No,
Mango
shellfish,
does
no,
not
shellfish
have
is
iodine.
iodine.
Shellfish.
Oh.
All, most of
Some
them.
allergies.
Mango, remember that latex allergy.
Are those avocado and latex?
Avocado, I don't know. No, mango.
Yeah?
Mango. Avocado, no. Mango is
Sorry
the
for them.
latex
They're
allergy.
allergic to mango. That's
You
awful.
I know,
that's
that's a
another issue.
delicious
You
thing.
might want, because those are latex-free gloves, but we were used to use just
So
regular
the people with
gloves,
latex
and the
allergies can eat
patient
mangoes?
might just go on you just right there before you check out.
Is it?
Okay,
Avocado.
so just a check.
Avocados like this.
What about, but mango is the one that first will be. Maybe avocado, but I didn't hear that much about avocado. And you see what we have here? That's going to be for you, those gloves. Okay.
They're not big enough?
I bought two different large ones for you.
What size are those?
They?
What size are those? Medium, right?
Gonna use those.
Extra small? Yeah.
Professor, those are not
I
good.
got it. I got it. I got it. You see, so that's why you got extra gloves, because you're dealing with situation, that's all. And I'm not gonna tighten my gloves, right? So you get supply that will fit you, because you save your time, right? That's all. Oh, that's what I like. Yeah. That's what I like. Okay. Now I'm strictly sterile, and I have to put 2 of them. There is no more foolishness. Okay, that's easy. All right. So now, patient is not allergic. I got lubrication.
If patient is allergic, with what do we clean it?
Soap and water. That's all. The best treatment, let me tell you. And now they're coming to the conclusion that still soap and water. All those antiviral things, not necessarily. What you have here, what is the important? That's if you need to
Urine
get
sample.
the urine sample. Putting that on the side. You got standard Foley here. 1 prong Foley, you see? So we can play with that Foley. We can put that on side. And here, I took that out, so I have to be careful. But at the moment, when I will go to bedside, this part is not gonna be sterile. That's only this part will be sterile, right? So I want you to remember that. But before I insert the Foley, I have to do some checkup.
Check the balloon.
Right, first checkup, you need to lubricate. Some teachers will tell you, put that here and rinse the catheter. No. Why should you do that? Look. You're gonna put simple and working.
What is he doing?
What I'm
Right.
doing?
You're putting it inside the tube?
Sure.
Inside the plastic?
the plastic.
Yeah.
Can I see first?
You can
That's not
see
what I did.
anything you want.
Girl, you're eating up everybody's screen.
Okay. And you are sterile. You're putting inside the jello. Okay.
But it's okay to put it in the plastic piece, right?
It's okay like you do like that. You see? You see what I did?
So it won't contaminate it.
And I don't touch anything. And it's fast.
Yes, and
At the bedside procedure, basically this is only the way. Second things, I'm getting testing now. I got 10 cc of water. That's normal saline. And I have to, that's a critical element. You have to show me. Check if the balloon, you see?
Yeah.
And you deflate that.
how many cc?
That's a 10 cc. That's a standard.
So you don't have to put all the water in, right? As long as you inflate it?
Yeah, but you want to deflate everything from the balloons. That should
Yeah, the
stay.
whole 10 cc's will fill in there.
Yeah, you see?
Yeah.
It's at the end.
You want to see again?
Yes.
Oh,
Okay.
yes, yes, yes.
You see?
Yeah, yeah, yeah.
And that tells you the catheter is patent, okay? And you leave that together. You see that? You leave it. Now, we have a swabs. I'm still sterile. You're gonna open. That's what you will be cleaning the patient, right? Patient is not allergic. My hands are already gluey, chewy, but I opened it up. And now, with that iodine, I got it. Sometimes we have to fight. I don't even have to put down there. You see? So now, I'm going to the room. You have to remember that you will be only one hand technique again. Because what you have to do with one hand, you have to spread the labia, right? And you have to clean the patient, right? So what I will do first is cleaning. Look here, okay? Going to the patient by sterility, right? I spread the labia. Okay, you can look. In, and I'm dumping right here. You see what? Going second.
That doesn't burn.
Inside you have to.
Yeah.
Now you see it right
I
here.
don't see.
Look. You see that? Just look. I'm gonna repeat.
Oh, okay.
You see? That's it. You don't want to go back and forth. If you clean inside, you don't want to go back in. It's just for hygiene. And another side as well. Okay, you done.
The first is the
Inside.
inside.
First inside, then from left side, right side. Three of them. You might have sometimes cotton
Do
swabs.
that again. It's gonna be where like
Do that again.
inside.
Yeah.
So,
The first
can
one.
you just okay, I will
First-
pretend.
Yeah,
Okay.
pretend. The first one for the
Okay,
first one.
first one. You spread the labia. Middle. Going middle.
Okay.
Damp it.
It's not a,
Left.
I've done it.
Damp
right.
it.
Right.
Right. Damp
Okay.
it. Got it? So now we got everything ready. I'm gonna take this one. Okay, as long you don't contaminate this one. And that's the hand that basically you don't want to release the patient because you don't want to contaminate. You see what I'm doing? And you hold like that. Around to 1.5 to 2 inches so you'll be able having friction to go there. And you simply, you found the hole, right? And you go to the hole.
Is it gonna eat in? Is it gonna go in that easy?
He's giving me questions. You're gonna go.
Yeah. you find
Okay.
the hole and you push.
You tell me I'm getting urine flow. I am getting urine flow. Of course you don't have a urine flow here. I'm getting urine flow. Fine. I don't have to be sterile anymore. I am just inflating balloon.
With the whole water.
Whole water. Not the holy water, but the whole water. Right? Damp it. I don't care.
And pull back.
You're gonna put the Foley catheter on the side securely. Put that securely. You're telling me the urine is flowing. Urine is flowing. Important things. And that's, you do that. Simply, because that's gonna be flowing, secure. You have to secure balloon.
do you
here.
secure?
Foley. How do you secure? Different places, they secure different things. We have a special like leg bag, you know, just the tape.
With a Velcro.
If you don't have a Velcro, something that's secure. As long you're gonna get the piece of tape or you're gonna tell me that I secured the Foley, you secured the Foley, and I know that you done. And then you're gonna put the label on the back when you start.
Where?
And you have to look on the back. You can put, you know,
So we could put it
or you
like
put.
for testing purposes. What we could say like we we
Right,
put a
you can
tape.
tell it that that's taped or just something. I will get you something because we don't have any leg strap. Nurses are creative. This is not critical things. How you gonna do? As long patient is comfortable, that's fine. And urine is flowing, you done. Now to take the Foley out, very easy. You're getting syringe. Not the same because that's going to be a few days later. Now. Right, you're getting just 10 cc syringe.
How long can the Foley stay in? 3 days?
Oh, usually 7 days
7 days?
max, and then you have to, accordingly to the condition.
Right.
If the patient urinating, as soon you can take the Foley out and patients urinating is better. You know, 100,000 people die every year because they UTI.
Bacterial infection, yeah.
Yeah. So it's just beyond control, I believe it. And you know, it's just patients who are in nursing home, in hospital, it's just getting worse and really is getting scary, guys. Really is getting scary. What you do, you come to that port, you press in. You don't have to be sterile, not at all. But you want to position the patient again in comfortable position. That's not a critical element. You took that 10 cc out and you tell patient, take a deep breath. Thank you very much, Foley is out. Okay. You're done with the skill. You position the patient, that's all.
Do sometimes they take it off without deflating the
Yes.
Yeah,
Yes, they
Oh,
do.
And there's blood all over
Yeah,
Thank
the
you
place.
very much.
asking because
Thank you very much. And I
No,
seen
thank
that.
you.
And
No.
I seen that nurse with